Historically, there have been literally dozens of operations that have been done for intentional weight loss. However, over the course of the last several years, things have really gravitated to three main operations that are done. So let's talk about those three operations. The first of the three operations I want to talk to you about is the gastric bypass. Now, this operation has been done for a long period of time, since 1967, laparoscopically with a little incision since 1993. This is a complex operation. In this operation, what we're actually going to do is divide the stomach into two pieces. One proximal, very small stomach pouch. That pouch is about the size of a large egg, so a very small little reservoir for people to eat. What we're also going to do is divide the intestine and bring one of the cut ends of that intestine up to connect to the small stomach pouch. And what that does is it will reroute the way food goes through the intestinal tract, bypassing the majority of the stomach as well as the first part of the small intestine, which may have profound effects on certain disease processes like diabetes, for example. Now, this operation is very aggressive when it comes to expected weight loss afterwards. We expect most people after a gastric bypass to lose 70, maybe 80% of their excess body weight loss. Now, that's an important term for you to understand. Your excess body weight loss is the amount of weight that you have to lose, the fat, in other words. That's what we're trying to get rid of. That's what we're attacking. So we expect for this operation to produce about 70, maybe 80% excess body weight loss in most patients. The operation on the negative side of things does have some malabsorptive components, so you're going to have to take certain vitamins and minerals in order to account for this change in your anatomy. And the complication rate for this operation in most studies shows about a 10 to 15% complication rate. Okay, so about 10 to 15% of patients are going to require an additional intervention, whether that's another small procedure or readmission to the hospital, replenishment of vitamin and mineral levels, whatever it happens to be. But again, that's the gastric bypass. The next operation I'll talk to you about is a sleeve gastrectomy. Now, this is a newer procedure. This operation was actually part of a two-stage operation previously called a biliopancreatic diversion with duodenal switch, but now these operations are being done as a standalone procedure. And in this operation, what we're going to do is we're going to remove about 70, and some people as much as 80% of the volume capacity of your stomach. And what that does is it produces a severe restriction in how much that patient can eat per meal. Now, the other thing that it will do is it will actually absolve them to some degree of hunger early after that operation, because of the way that the production of Ghrelin, which is a hormone that's produced in the lateral portion of your stomach, is reduced early after that operation. Now, that's a tremendous adjunct to the power of the operation. So not only are patients not able to eat as much, but they also are not hungry early after that operation. You get the same effect actually after the gastric bypass. But in any event, as patients do regain hunger in the future, the restriction of the volume capacity of that stomach will reduce how much they're able to get in per meal. Ultimately, I would expect for this operation to allow you to eat about a child's portion of normal food once you've healed from the procedure. Now, the other thing about a sleeve gastrectomy that I should mention is it has a very low complication rate. Of all the procedures that we do, it has the lowest complication rate. Most studies showing about 2-3% complication rate. It's extremely low. The lat band is the last operation I'll talk to you about. Now, this operation involves the placement of a silicone band at the top of your stomach. This band has a balloon in it that we can adjust in effect, and you'll have a small port that sits below your ribs underneath the skin that we can access with a needle after we numb the skin, and we'll inject fluid into that port, okay, that little access port that you have under the ribs that I mentioned. And that fluid will go from the port through the tubing into the balloon, and as that balloon inflates, it will essentially tighten on the stomach that it's wrapped around. Okay, and as it tightens, it reduces the amount of food that you can eat per meal. Now, if we get it too tight, we can reduce the amount of fluid that's in there. So it's adjustable. It's also reversible. If somebody doesn't like the way it feels, or they don't like the results, or they're having problems from the procedure, then we can remove that band. And I think that reversibility is also an attractive aspect of the lap band. Now, this operation actually has the highest complication rate, ironically, of the procedures that we do. About 20 to 30% of patients are going to require some additional intervention in terms of a procedure in order to address the problems that they're having. But these operations produce, as I say, a tremendous amount of weight loss. And the lap band produces about 40, maybe 50% excess body weight loss. The sleeve produces about 60 to 70% excess body weight loss. The gastric bypass, again, produces about 70, maybe 80% excess body weight loss. Again, going back to the complications, looking at a 2-3% complication rate for a sleeve, 10 to 15% complication rate for a gastric bypass, and about a 20 to 30% complication rate for a lap band. The gastric bypass and the lap band are reversible procedures. The sleeve gastrectomy is not. But these operations, as well as we try to do them, none of them are magic. Okay, they're going to require the understanding and the execution of the game plan that we create together in order for a patient to realistically succeed and achieve the goals that they have when we set forth before we did the procedure. Okay, and also they will allow for patients to experience resolution of many of their medical problems, certainly improvement of these conditions, and then these improvements can be profound in many patients.